Hello, everyone, and welcome to Your Healthy Dose, a podcast about current trends in healthcare. I'm Kim Douglas, your host, and I'm very excited about what we're going to talk about today. It seems to be all over the headlines and the news and all over social media. Gut health. That's the topic. I'm excited to have with me here today Dr. Anton Bilchik and Dr. Rudolph Bedford. They are co-directors of the Digestive Health Institute at Providence St. John's Health Center. And I wanted to have both of you tell me a little bit about your credentials. So let's start with you, Dr. Bilchik.
I am the Division Chair of General Surgery at Providence St. John's Health Center, Director of the Gastrointestinal Research Program at St. John's Cancer Institute, and Director of the Hepatobiliary Program.
And what about you, Dr. Bedford?
Well, I'm a gastroenterologist, the Director of the Gastroenterology Section here at Providence St. John's Hospital, specializing in advanced procedures and everything there is to do with gastroenterology.
Right. Well, we're going to start with a topic of something that everybody really truly is interested in, and that is how your gut affects how you feel. So we want to talk about, listen, there's nobody I know that doesn't love food, but not all food loves us. So how do certain foods affect our moods and our energy and basically our health?
Well, I'll take that on. There are a variety of foods that affect our mood and our general health. Most notably, things that cause fluctuation of your blood sugar, such as simple carbohydrates. You're much better off with complex carbohydrates, such as oatmeal, to stabilize your blood sugars throughout the day. Lean meats, slowly digestible things, fish, etc. And there are a lot of other components within your foods. Most of us, quite frankly, do know the good and the bad and the ugly in terms of foods that we should stay away from and those that are healthy for us.
Right. So you've just listed a few that are good for us. How about we find out the ones that aren't good for us? And I'm afraid to ask.
Well, these are all the foods that I like and that I enjoy and that I, struggle with to not take. And, I think the big buzzword now in the whole field of gastrointestinal diseases is inflammation.
Right.
And what Dr. Bedford just spoke about are all the foods that are anti-inflammatory. Well, guess what? All the foods that I like are pro-inflammatory. Caffeine, chocolate, a glass of wine every now and then. I like a little bit of red meat, cheese. So it's really important people understand that we've got all these bacteria in our body called the microbiome, and one of the causes of gastrointestinal diseases, also gastrointestinal cancers and even heart disease, is the inflammatory effect that some of these foods likely have on these bacteria that then cause diseases.
And the processed foods, I'm sure, is another one. So what foods should we really make sure are a part of our daily menu?
Fruits, vegetables, things that are high in omega-3, such as sardines, salmon, etc. Better quality fats, such as avocado, things that are essentially unsaturated.
Okay. And you're so right, Doctor. It does seem like we kind of know that. It's just the implementing it and trying to stay away from.
Well, what someone once said to me is that when people go to a supermarket, they generally go to the middle, start in the middle, and then they work their way out.
Right.
But what's actually a whole lot better is start on the outside and move your way in.
So true. So true.
Or maybe not go in at all.
Exactly. Okay, so this is a very tough one. Is there a direct link between food and cancer?
There is now level 1 evidence that processed meat and red meat is associated with colon cancer. Large scientific studies have now been done, and whenever we talk about level 1 evidence, that is about the highest level. That is the highest level of evidence that you can get, rather than what we often hear about, which is an association, which would make it level 3 or level 4. So it's very, very clear that if you eat processed food every day, or if you eat red meat every day, your chances of getting colon cancer go up considerably.
Wow. That is amazing. And you would think level 1, as a layman, I would think that's the least, but you're saying that's the highest.
That's correct.
Wow. All right, let's move on to the basics of colon cancer. And we're going to talk about the incidence of the increase worldwide. What is going on and why are we seeing this increase?
Well, I wish we knew, but there certainly is an increase. I think generally the world is becoming more westernized, much more processed food. Obviously, the rate of obesity, alcohol consumption, lack of exercise, all of these are contributing factors. But at the end of the day, we don't exactly know why.
Right. But don't you think that, unfortunately, people like Chadwick Boseman, who was so much younger and in good shape and healthy and most likely not eating a huge diet of these inflammatory foods, him getting something like this and it being out there broadcast in social media and out on different platforms has brought more attention to this topic?
I really hope so, because it's not only clear that colon cancer is going up considerably in people under age 45, but it's going up disproportionately among African Americans. And so although the current screening age is age 45, there is good evidence that it should probably be even lower, particularly in high-risk groups like African Americans. But as Dr. Bedford said, the cause is really unknown. What we do know is that the majority of colon cancer is preventable, but it likely starts at a very young age. Chadwick was someone who exercised frequently, was vegan, was not overweight, did Tai Chi every day, really was in great shape. And it leaves so many unanswered questions that we're trying to address right now within our laboratories to try and better understand what are the triggers, when do the cells start changing, is it something that begins when you're 3 years old? Should parents, really be aware that that these pro-inflammatory type foods really need to be avoided, not when you're 25 or 30, but maybe when you're 2 or 3 years old.
Wow, that is... Do you concur?
I concur. I just want to throw in there that all of these wonderful things that Dr. Bilczek has had to say about Chadwick, but in addition, he actually had no family history of colon cancer whatsoever. So he really, not only average risk, one would say low risk.
Wow. That is discouraging, I have to tell you, because on a personal note, I'm not exactly vegetarian, but I eat very, very little red meat. I drink my green juices. I try to keep my weight in check. I exercise. I don't drink a lot and I don't smoke. And I too got stage 3 breast cancer. And it's just so, you try to check off all the boxes. And like you say, maybe it's from very young, having certain things that you did. So it's so important. I guess that just brings the point home of early screening and how important that is. Tell us about the current colon cancer screening in America and how you both advise your family and friends.
So colon cancer screening has been revised in 2021. The United States Task Force has brought the screening rate down to, or age down to 45, although many of us, as Dr. Bilczek has stated, would like it to even be lower.
Yeah.
But we usually advise our patients and family to start screening at 45, and provided that no polyps are found every 10 years afterward, and provided that they are not at increased risk of colon cancer due to family history, again, every 10 years afterward.
Wonderful. All right. So now that we've talked about that, let's talk about you two. Let's get into your backgrounds. So tell me how you both got into this area of medicine and describe your approach to treating patients and how the two of you teamed up as the George Burns and Gracie of St. John's.
I don't know which one is George
I know,
Burns
I'm not going to say
it. Gracie. Go ahead, Dr. Bilczek.
Well, before I answer that, I think I have a confession to make. And that is that I was very reluctant to get my first colonoscopy. And I didn't get my first colonoscopy at age 50. It was a few years after that when my wife literally dragged me to get a colonoscopy, called me a hypocrite, and a few other words, so that I, and I have to say, it was the best 10-minute sleep I've ever had.
There you go.
It was so easy. It was so not a big deal. Fortunately, I got lucky. Everything was clean, but my wife, really literally had to, drag me there. So I fully understand. Colonoscopic hesitancy, if there is such a thing.
Right.
But having, been hesitant myself and having gone through it, it is absolutely not a big deal. And I just encourage everyone to, get it done.
But before you came in, I will tell you, I was talking to Dr. Bedford, and they said that drink and drinking it and not eating. And he said that possibly we can look forward to maybe a blood test down the line and not that horrific drink.
Well, there are different ways of screening. Certainly, we have the stool test that everybody sees that wonderful commercial on TV. But there will in the future be something called a liquid biopsy, whereby you'll likely go to your primary care physician's office, and along with all the other blood tests, you'll have blood drawn looking for circulating DNA of a variety of cancers, not just colon. So that will likely supplant some of the screening that we're doing now. And, the goal is to increase the number of people who are being screened.
Right.
In a situation where we're seeing a rise of this cancer, especially in younger people.
Of course. Now, you both avoided the question about your backgrounds. So let's get back to you. You're certainly not Hollywood, because you'd be talking about yourself all the time. So let's go back to how you got into the area of medicine, how you two teamed up, and your approach.
I'm originally from South Africa. I went to medical school there, left during the 80s when things were really heating up, was given an opportunity at Yale University to do gastrointestinal research, and I never looked back. I found it one of the most fascinating areas to study. Then did my residency at UCLA. That's where I met Dr. Bedford. Right. Dr. Bedford was at UCLA the go-to guy for everything difficult in endoscopy, and also the go-to guy because he was always, the most accessible. He took calls from whether you were a resident or an intern or an attending. He treated everyone the same, and he never said no to any patient. So that's when our friendship and our working relationship started. We're talking about more than 30 plus years ago. And that's really what led to, the working relationship and also just the opportunity to do better and especially relating to digestive health, recognizing that if we can break down silos and bring people together, that it's an amazing opportunity since, as you mentioned, we are what we eat.
Right.
Our gastrointestinal tract controls just about everything, and our brain controls our gastrointestinal tract. So it's such a important organ to understand.
Absolutely. How about you?
So I'm originally from New York, trained at Case Western Reserve and the Cleveland Clinic. Moved out here to California, where, of course, I ended up at UCLA as the director of the Pancreatic Biliary Interventional Services, where I met Dr. Bilczek. It's been a wonderful relationship over the past 30-odd years. Now here at St. John's, again, as I've stated earlier, as a director of gastroenterology. And, what can I say? I truly enjoy what I do. I do it well, I believe.
Yes.
And we're here to do the best we can for the patients.
So how did the two of you team up, and was it a good idea?
It was a great idea.
Yes.
What do you mean was a good idea?
I know,
It was
absolutely.
it was a great idea. The bottom line is that, as Dr. Bilczek will tell you, we tend to work in silos. Having a team approach to the care of an individual patient, I'll give you an example. Dr. Bilczek will just call me about a patient that he's currently seeing. And as he stated earlier, I do pick up my phone. I will see that patient either that day or within the next 24 to 48 hours. We will proceed to get all of the studies done in a very expedited fashion, and our team will essentially provide the care that's needed within a very short term period of time. So this does not happen in most institutions, no matter where you go, certainly in this country. So it has been a fulfilling relationship between myself and Dr. Bilczak over the last 20 to 30 years, and we have been operating the same way throughout.
Wonderful.
Can you imagine that you have two people that actually communicate by talking to one another?
I know,
By
right?
talking to one another. It's not some random text or some random email or through some other system, that we actually are, having a verbal connection. And I mean, truly, many people we've seen have said the fact that we can, communicate and get things done
Yes.
within a couple days is so different to their other experiences.
Exactly. You can't get anybody on the phone anymore.
Like, I can't get my kid on the
I
phone.
know, exactly, right? So what is St. John's Healthcare Center doing to advance treatment and cures? And I want you guys to tell us a little bit about Stand Up to Cancer Initiative and about CHAT, C-H-A-T. What does that mean?
So we started an initiative based on the inspiration of Chadwick Boseman to improve screening rates, particularly among underserved populations within our community,
Right.
knowing that this is a preventable disease, and knowing that there is a large amount of hesitancy towards colonoscopy and towards screening. And this gave us an opportunity to come up with a term, CHAT, Community Health Action Teams, the concept being that we don't know as much about the community as the community leaders do. And a common mistake that a lot of people make that want to do good is think that they know better than the community that they don't live in, and go there and just say, you know what, you need to get screened, without having a mechanism. If someone does screen positive, then what?
Right.
And there are a lot of uninsured and underinsured people. So this grant, funded through Providence and Stand Up to Cancer, has given us a chance to work with these chats, these community health action teams, these leaders, to be able to reach the community, get them free screening, and then see them all the way through. So if someone tests positive, we can then get them a colonoscopy, rather than have them say, oh gosh, I just can't afford this,
Right.
or I can't do this. So we want to see this through to make a difference.
Love that. And you were saying earlier that it would be reaching out to maybe the churches and the local politicians and the teachers and the leaders within those communities. And I think that's so valuable.
That is correct. So it's, again, as Dr. Bilczak has said, all the community navigators,
Yes.
as we refer to them, they know best for what their community needs are. And we're hopeful that this will be a project that, if successful, will be mimicked throughout the country.
Yes. And do you feel that the treatment and going through what Chadwick Boseman did has changed the optics for different communities in knowing that it isn't, as you said, an old people's disease or old people's screening?
We believe so. I mean, the one thing that Chadwick, or actually two things that Chadwick has brought out, that this is certainly a disease also of the young, and this is a disease that African Americans have a higher rate of.
Wow.
And those two things alone, we're hopeful will open everybody's eyes and will, bring about a recognition that screening, even at 45, is something that is necessary.
Right. And then as we move into more of the screening topic, what are your goals and the national goals for screening in the future?
Well, the national goals are to screen 80% of the population.
Really?
And currently, there are some communities, for example, some communities in tribal communities in South Dakota that are in single digits for screening. And the communities that are surrounding us in Los Angeles, the screening rates are about 65%. So our goal is to get that 65 to 80%. And again, it's astonishing that, during COVID, the screening rates were as low as 15 to 17%, which makes us very worried that we're about to see a surge in colon cancer, even higher than what we're seeing now.
Oh, let's certainly hope not. And what are the modes for screening?
So the modes for screening, obviously the gold standard is colonoscopy. We do have other screening methods such as a Cologuard study, which is the stool in the box. Other screening methods that are flexible sigmoidoscopies and barium enemas, which really have become passé. But for the most part, colonoscopies are still the gold standard.
Yes, absolutely.
As far as our goals, we're already meeting many of those goals. There are still many more to attain. But the fact of the matter is that we work well together. We are in a impressive community hospital, probably one of the best in the nation, and we do provide university-like care in a very expedited, efficient fashion. I mean, patients truly are not wanting for waiting for care to be delivered to them here between myself and Dr. Bilchek and the team that we've put together.
Yeah, you're pretty amazing. And now I want to hear from both of you about the Digestive Health Institute, or DHI, at St. John's. Tell us about that.
Go ahead. We can do it together.
I know, right? Absolutely.
We'll sing.
Exactly.
So, the whole goal is to create a environment or an institute in one building with multiple specialties, but also ancillary groups of people such as nutritionists, psychologists, all in one place at one time, with the ability to do cutting-edge research such as artificial intelligence to help people predict what they should or shouldn't eat, how they can prevent gastrointestinal diseases. And can you imagine if you could just do that all in one afternoon?
Oh, for the patient, it's just so helpful. Well, this has been so informative. I have certainly learned so much, and I know our viewers and listeners have too. So I want to thank you both for being here today. It was wonderful to get to know you and hear all about your experience and the exciting things you're doing in this field. And I also want to say thank you to St. John's Health Center Foundation for making this possible. And thank you all today for joining us. We'll be back next time. I'm Kim Douglas.